I'm Sue Baxter from the University of Sheffield. This presentation is on public involvement in research reviews, practical guidance from an evidence synthesis centre. The Evidence Synthesis Centre is funded by the National Institute for Health Research as part of the Health Services and Delivery Research Programme. So we carry out programmes of work which last typically around 3 to 4 years, with lots of different evidence synthesis projects within each programme. This flowchart sets out basically how it all works. So NIHR carry out consultation, a topic, usually quite a broad topic, comes to us. We develop the focus and the questions with input from stakeholder and public engagement, and also decide what type of review product is best suited based on resources and time available. Our review outputs go back to NIHR and are used to inform policy and future research funding calls. So what makes public involvement in one of our centres different? Well, most PPI tends to focus on people's lived experience. So a research project might recruit people because, say, they've got a particular health condition, or perhaps have got experience of a particular sort of service. Whereas we're actually wanting people with much broader interest in health and social care. As it's a secondary research project, obviously there's no requirement for our public advisors to get involved in things like recruitment or data collection. And our advisors tell us that their involvement is quite different because it's over a longer time frame than you typically might get in many research projects. The blue box at the bottom of the slides just gives an example of just some of the projects that we've been asked to look at evidence on over the past few years. And you can see just how varied the sorts of topics are. So who and how do we recruit to a public advisory group? Well, we're interested and looking for anybody really who's got an interest in health and social care. We try and select for variety or diversity in terms of things like gender and age and background and ethnicity. And we also find it's useful to have people from a spread of areas across the country, people living in cities versus rural areas. Because experiences of health and social care can be very different in different places. We usually look for a combination of experienced public advisors, but also people who are newer to the role. The experienced members are really helpful in terms of mentoring anybody that's new, but we do find that often people who are newer to public advisory roles can actually contribute some really interesting and fresh insights. We tend to use the excellent People in Research website, where you post your opportunity and people will reply directly to you. We sometimes snowball from our existing groups, although of course you have to be careful that you're not tending to hear from the same types of voices. And other places to advertise are charities and community groups. We would invite applications, but make it clear that there will be either an interview or just a screening of applications. Because we're really trying to select for diversity, it's really important to make clear to people that just because they apply, they won't actually become a member of the group, and that there will be some kind of screening process. Our public advisors put together a little leaflet or flyer with some of their quotes on, which I think is a very nice introduction to send out to people. So how can public members contribute? I've subtitled this, or it's not just the plain English summary, because often when people think about public advisors in research, evidence synthesis research or systematic reviews, people are sort of puzzled as to what their role might be, and oh yes, they can do the plain English summary. Yes, people are very good at rewording text to make sure it's clear to a public audience. But actually our public advisors contribute much more than that. There's a lot of good guidance around on how to involve members of the public in research. For example, this NIHR briefing note document, which makes it very clear that advisors can have roles and input at different stages of the research process. While there's some really good guidance around, we do tend to find that often this guidance focuses more on the kind of principles of involving members of the public, and it often is less clear on exactly how you might involve people, and particularly during evidence synthesis projects. So in the next few slides, I've tried to give some ideas of exactly how people might be involved. So it's really four different places during a research cycle. So input to the research question and the focus of the study. Are we asking the right questions? What's important for members of the public to know? Have we actually got the focus of the study right? We like to go back to a public advisory group just as we've perhaps done our first searches and our first set of sifting, really to report back to them what we're actually finding, and to ask whether we think we're missing anything. Are they perhaps surprised what we've found? Are they surprised what we've not found? Do we need to perhaps tweak the search terms a bit? Is there something we're missing? Input to interpretation is really important. As researchers, sometimes we kind of get too involved in the nitty-gritty of actually what we found out. And we do find that public advisory groups are really good at picking out kind of headline messages or key messages from research findings. And then the fourth area is really opportunities to input into dissemination. So our advisors help with things like evidence summaries, infographics, and then thinking about avenues for dissemination, and also with our other outputs. So the sorts of activities you can do, if you're doing something like a qualitative evidence synthesis, it can be really interesting to present back to your public advisors things like the barriers and facilitators that you found mentioned in the research literature, and really ask them whether they think they're the sorts of barriers they would have expected to see. Again, is there something that's missing? Could they think about which ones might be more or less important? So again, presenting back qualitative findings can be really, really useful. We did a review on preventable hospital admissions, and we used the research evidence to develop some scenarios, or a little kind of pen portraits about how different people might respond to going to hospital. So we sort of turned these into scenarios and asked our public advisors to comment on the how clear and actually whether they actually were useful in conveying the findings of the review. It was a really useful thing to ask. In a realist review, we always ask public advisors to contribute to development of the theories. And in this review of access to social care, we then took the theories at a later point back to our public advisors to ask whether it was possible to rank them or cluster them in terms of how far they added explanatory value. So top tips, I think my number one tip would be specific about what you want from the group. Sometimes researchers present findings or present things to public advisors, and our advisors tell us that they're often not sure exactly how the researchers want them to contribute. So being really clear and really specific about exactly what you want from the group, I think, is important. Having a contact at the researcher end is really, really important, so people know where to go. Thinking about offering training, asking people what training they might like, again, really useful. Always providing information in advance before meetings. We try and do at least 1 week ahead. Asking if people need paper copies, again, really, really important. There's some new guidance out on payment, which is worth having a look at. So that's really, really useful. Our public advisors always tell us that sometimes researchers can forget about feeding back to them exactly what happened later on. So, what happened to the research findings? How did their contribution actually affect the way the research was written up? So remembering to always feed back to public advisors, again, is really an important part of working with them. Evaluation of public input is really challenging. We always document the influence of our advisory group on the process and also the outcomes. But it's important to remember that the effect of the advisors isn't always just to this project. That sometimes they make contributions which we then might use later down the line, perhaps in developing other bids or, in terms of understandings of other topic areas. Some people do research evaluation with public advisors, but it's important to recognise that this can actually change the relationship that you have with people if they change from advisors to research participants. So thank you for listening. If you've got questions or comments, please contact us and we'll respond. And the link to our public advisor website is on this slide. Thank you very much.